My name is Ruby Jackson, and I am a breast cancer survivor. The purple tea, I tell you, I am just so excited about it because you learn a lot about yourself, how to prevent breast cancer, and also to know what to do for others if they come across breast cancer in your family. The American Cancer Society has a lot to do with the purple tea. Here, ladies, you will learn and gain knowledge about the prevention. Are you at risk for breast cancer? What can you do? Also, the numbers are very large in the United States for people dying of breast cancer and cancer itself. Over 600,000 people last year died from cancer. Now, that's over 1,500 a day people dying. So we just want to gain knowledge on how we can prevent this and how we can share with others what we learn here today. Thank you.
Cancer is a disease that begins in the body's fundamental unit of life, the cell. Cells grow and divide in a very regulated and orderly process to produce more cells when the body needs them. Normal cells become cancerous when they fail to respond to the normal feedback mechanism of this highly regulated process and continue to divide. The extra cells generate tissue, which organizes to form a mass or tumor. Tumors can be benign or malignant. Benign tumors are not life-threatening. They can be removed and for the most part do not reoccur. They do not spread to other parts of the body. Malignant tumors are cancerous, and cells in these tumors are abnormal. They divide out of control, invading and damaging nearby tissue and organs. Metastasis occurs when cells break away from the tumor and enter the blood or lymphatic system, spreading to other sites in the body. Malignant tumors can be surgically removed. However, if the malignant cells have broken off and spread to other tissues or invaded surrounding tissues, excision will not cure the process. The tumor will grow back or continue to grow in another region. The site at which the malignant tumor starts is referred to as the primary site. Sites to which the tumor spreads are referred to as secondary sites. Tumors that spread outside of the primary site to the lymph nodes or other organs such as the lungs, bones, or liver are considered metastatic tumors. Breast cancer that spreads to the lung or bone is still breast cancer, not lung cancer or bone cancer. It has simply metastasized. It is difficult to protect healthy cells from the effects of breast cancer treatment. All treatment options for breast cancer, including surgery, radiation, chemotherapy, and hormonal therapy, can have side effects. These side effects are usually short-lived and can be overcome with medication and other treatments. Side effect management has vastly improved in the last 10 years. Surgery can lead to several potential problems, including short-term pain and tenderness in the area of the operation, infection, poor wound healing, bleeding, weight imbalance, and discomfort in the neck, numbness in the chest from irritation or cut nerves, and lymphedema, swelling of the arm and hand. Radiation therapy can lead to a number of side effects, including fatigue and skin irritation that makes the skin red, dry, tender, and itchy. Near the end of treatment, the skin can become moist, weepy, and discolored. Radiation side effects usually disappear when therapy is concluded. Chemotherapy drugs affect cancer cells and normal cells. The normal cells include red blood cells, which carry oxygen to the tissues, white blood cells, which help fight infection, and platelets, which aid in blood clotting. Chemotherapy can cause side effects including infections due to reduced white blood cell counts, increased bruising due to reduced platelet counts, and fatigue and anemia due to reduced red blood cell counts. Chemotherapy can also cause loss of hair, poor appetite, nausea, vomiting, diarrhea, and mouth sores. The side effects are generally short-lived and gradually go away, or they can be controlled with other drugs. Hormonal therapy can cause a variety of side effects including hot flashes, vaginal discharge, irregular periods, increased risk for cancer of the uterus, and a slightly increased risk of stroke. In rare cases, patients experience blood clots. A diagnosis of breast cancer can change a woman's life and affect the lives of those around her. These changes can be difficult. Patients with breast cancer have many questions. Doctors, nurses, and other members of the healthcare team can often answer these questions. In some cases, doctors recommend that a patient talk with a counselor, social worker, or member of the clergy. Family members and relatives can provide help and encouragement, and patients often find comfort in breast cancer support groups which are active in most areas. Each individual has different needs, and what works for one person may not work for another. There are many organizations and special programs for patients with breast cancer, as well as many different books and websites on the Internet.